Hello friends, I am Dr. Gaurav Agrawal. I am a Pediatric and Fetal Cardiologist working at Delhi. In last two videos, we will discuss about the types of VSD and signs and symptoms related to the VSD. In this video, we will discuss how do we diagnose this issue. Either your pediatrician will tell you that some sound is coming, or whenever your child is having some form of difficulty in breathing, difficulty in feeding, excessive sweating over forehead, poor weight gain, frequent pneumonia and like situation, then ideally you should also consult with a pediatric cardiologist so that he can assess better whether the child is having some heart problem or not in the form of VSD. In case of large VSD, symptoms generally starts around 1 to 2 months of age when the child is born full term. 2.5 to 3 kg weight is there at the time of birth. In preterm babies, the symptoms can occur early also, around less than 1 month of age. For diagnosing the VSD, the best test is Transesophageal Echocardiography that we do from the chest of the baby. Ideally, the child should be quiet and comfortable, and the child should not have the sando under the shirt, and the shirt should be front open, or t-shirt should be the front open so that we can open the chest properly. Do we require some form of medication to conduct this test? Generally, we don't give any medications, but if the child is excessively uncooperative, then in that case, we give some oral medication so that child will sleep and we can conduct this test after sleeping the baby. There is no role of any IV intravenous medication to calm the child. There is no need to get admit for this test also. Another test that we can do is the Transesophageal Echocardiography that we do from the mouth of the patient. It is generally done in bigger children or in case of adult or adolescent, because in that case sometimes transthoracic windows are not clear. Then in that case, for a better assessment, we need to do the Transesophageal Echocardiography, especially when there is an associated aortic valve problems are also there. Other tests that we can do if required only for assessing whether the VSD is still treatable or not treatable. For doing that, we do cardiac cath angio study. For that we have to admit the child for 2 days, and we have to keep the child in cath lab for assessing the lung pressures and other parameters so that we can make a conclusion whether the child is still operable or not, or we can treat or not. For more detail, you can log into my website childrenheartcare.com. In next video, we will discuss how do we treat VSD in pediatric age group. Thank you very much.